Good day, clinical instructor. So today I will be removing a nasogastric tube. So the purpose of this is after therapeutic nourishment and management via NGT, we are done. So the equipment that we need to use are disposable tab or towel, tissue, um, clean gloves, the 50 ml syringe, the moisture proof or trash bag. So, assessment. We need to assess for the presence of um, bowel sounds, also for the absence of nausea or vomiting when tube is clamped. So we'll check the bowel movements of our patient. So it should be, the sound would should be gargling sound. So the implementation is we will confirm the primary care provider's order to remove the tube and then assist the client to a sitting position if health permits. So if our client is already in a sitting position, we will place a disposable pad or towel across the client's chest to collect any secretions um, or spillage of secretions from the tube. So this is also for hygiene purposes for our client. Next is provide tissues to the client to wipe the nose and the mouth after the removal. And then also performance. We need to prior to removing um, or prior to performing the removal, introduce ourselves and verify our client. So I am Nurse Michelle, your nurse for today, and you are. And then after that, we will explain to the client what we are going to do. I will be removing your NGT so that you can now eat or have drink as your doctor permits. Then also perform hand hygiene and observe other appropriate infection prevention procedure. So I will be putting our clean gloves, and then also we will now provide the client privacy by closing the doors or the windows or curtains in the client's room. And then also we will detach the tube um, by applying, we need to apply our clean gloves. And this to connect the nasogastric tube from the suction apparatus. For example, this is our suction apparatus. We will disconnect our nasogastric tube, and then unpin the tube from the client's gown. Yeah, we already have pinned in from the client's gown. And then also remove the adhesive tape securing the tube on the nose. And then remove the nasogastric tube or instill 50 ml of air into the tube. 50 ml into the tube. Also, the rationale for this is this clear the tube of any contents such as feeding or gastric drainage. And then also ask the client to take a deep breath and hold it. Can you take deep breaths and hold it for me? Okay, thank you. This closes the glottis, therefore preventing accidental aspiration of any gastric contents. So pinch the tube with a glove hand. So because pinching the tube prevents any contents inside the tube from draining into the client's throat. And then smoothly withdraw the tube. So we need to place our tube into the trash bag. So this will um, immediately prevent the transfer of microorganisms to the client. after that is we will now observe the intactness of the tube, and then also ensure the client's comfort. We will clean our patient's mouth and nose. And then provide mouth care if desired, if the patient wants to his mouth to be brushed. And then assist the client as required to blow the nose. So excess secretions may have accumulated in the nasal passages. So you can sneeze if you want. And then dispose the equipment appropriately. Place the pad, the bag with tube and gloves in the receptacle designated by the agency. So correct um, disposal prevents transmission of microorganisms. And then remove and discard the gloves. Then we will now perform our hand hygiene. So we need to document all the relevant information, record the removal of the tube, the amount of um, appearance of any drainage if connected in such, and also we need to evaluate. Perform a follow-up examination such as presence of bowel sounds, absence of nausea or vomiting when tube is removed, and intactness of tissues of the nares. Next is relate the findings to previous assessment, data if available. Report significant deviations from normal to the primary care provider. And in documentation, we need to document all relevant information such as the record the removal of the tube, the amount and appearance of the secretions, if connected to suction, and any relevant assessment of the client.